Hello everyone, we are Group 8. For the U21 challenge, we would like to address the issue of language equity of American Sign Language users in ED triage. This is our team. The problem we aim to address is the lack of an efficient bidirectional AI communication system for live consultation between deaf American Sign Language users and emergency department triage staff. This is especially important in emergency settings, where rapid and accurate communication is critical for patient assessment and clinical decision making. Communication barriers can lead to misunderstandings, delayed care, and poor patient experience. Research also shows that deaf and hard of hearing patients spend about 30 minutes longer in emergency department than hearing patients. These challenges affect both deaf patient and triage staff, making timely and accurate information exchange difficult and contributing to ongoing communication inequities.
There are several social and cultural factors that contribute to this issue. Firstly, ASL is not simply a visual form of English, it is a distinct language with its own grammar and structure, meaning written English is not always an effective substitute. Many deaf individuals also have lower English literacy levels, which can create additional barriers when accessing healthcare. The deaf community may also experience lower socioeconomic status, educational attainment, and health literacy. Combined with limited access to health information in sign language, these factors can make it more difficult to understand health conditions and navigate the healthcare system. So why do we need to solve this problem? Communication difficulties are among the most significant challenges faced by deaf patients in emergency departments. Around 70% of deaf and hard of hearing patients report being unable to communicate independently with emergency department staff, and interpreter access is often inconsistent. Although video remote interpreting services are commonly used, technical issues and limited accessibility can reduce their effectiveness in the emergency department setting. As a result, deaf patients experience significant health inequalities. Communication barriers are linked to longer emergency department stays, increased risk of misdiagnosis, reduced patient safety, and greater emotional distress.
Current solutions for deaf staff communication in the ED falls into two categories: human-mediated platforms, example Propria One and VRI, which provide live interpreters on demand, and digital tools, example Medibabble, which rely on pre-built phrase libraries. A near option, Sorrent and Omnibird, uses AI for ASL to English translation, but is not designed specifically for healthcare. None combine real-time AI-driven two-way communication with the medical accuracy and reliability required for ED triage. Interpreter services are accurate but can be delayed by connectivity issues and interpreter availability, while phrase-based tools are limited to scripted interactions. General AI translators lack the clinical vocabulary, safety safeguards, and documentation features needed for high-stakes healthcare settings. As a result, current solutions force a trade-off between speed and accuracy.
But what if technology could bridge the gap? Our solution is a bidirectional artificial intelligence system that understands American Sign Language and signs back. Here's how it works. As shown in this AI-generated image, a tablet with a camera sits at triage. An AI avatar appears and signs, "Why are you here today?" The patient signs them back, and within 2 seconds, the text appears on the staff screen. The staff select follow-up question, and the avatar signs them back. If the AI is uncertain, one tap connects to a live human interpreter through video remote interpreting within 10 seconds. The system also automatically logs American with disability as compliance. So, what makes our solution unique? It is bidirectional, operates at rapid triage speed, uses an ASL avatar, has confidence-based escalation, logs ADA compliance, and work offline. No existing solution combines all of this. Ours is the first designed specifically for the 3 minutes that determine how urgently a deaf patient gets treated. The solution will be delivered by hospital administration and ED staff working alongside IT developers, linguists, and regulatory body to ensure accuracy, safety, and equity in every interaction.
We will evaluate the impact of solution through clinical communication and patient experience outcomes. Key measures include length of stay, time to triage, and ED revisit rates. We will also assess communication accuracy, staff confidence, and patient satisfaction, as well as whether communication barriers are reduced.
Now identify the beneficiaries who we can also consider are key stakeholders. So firstly, the patient and the family gains two benefit: greater transparency and improved safety and well-being. Using an AI interpreter removes any communication barriers, ensuring full understanding of their medical needs whilst maintaining full autonomy over their treatment. It is under the US ADA that hospitals are legally required to provide deaf ASL patients and members with a qualified interpreter, or else classified as undue burden. Any ICF signed without a qualified interpreter will be voided. Moreover, AI can mitigate diagnostic latency, reducing any emotional burden. Next, the clinician gains two other benefits: improved time efficiency and clinical clarity. AI is always available on standby, which allows instant communication with patients to eliminate any treatment delays. Furthermore, a similar research found that 88% accuracy in AI interpreting ASL and ISL. Thus, this reduces clinicians' risk of malpractice, which brings me to the hospital authorities. Utilizing AI provides a safety net for the hospital to always be in full compliance with the ADA and Civil Rights ACA, ensuring 24/7 interpreters availability. The AI is designed to fully interpret medical terminology in ASL, thus reducing HR recruitment's overhead and expenditures.
As ASL heavily depends on facial expressions, micro movements, and body positioning to convey nuance, there is a greater scope of misunderstanding with the use of AI. This gap in communication hinders the collection of informed consent, as the connotations in language are harder to document and regulate. This is also especially a concern during triage, as a patient's description of their symptoms and expression of uncertainty are major determinants of course of treatment. Privacy of patient data is also a primary concern, as machine learning requires maintenance of large datasets hosted on servers outside the clinical environment. The compromised care for deaf patients due to the affirmation factors could also be exacerbating existing disparities, as machine learning requires large datasets and there is limited data on ASL compared to more widely spoken languages.
Well, to conclude, the project is about improving language equity in emergency care. Our AI communication system help us deaf ASL users communicate more quickly and clearly with the clinics. We are still allowing escalation to human interpreters when needed. Overall, it can improve safety, reduce delays, support informed decision-making, and make it ED more accessible and inclusive.